Undoubtedly, the assessments helped us in developing a project design with meaningful strategies and processes. To ensure that the community-centered processes were properly harnessed, and also to ensure that the project did not get influenced by ups and downs or periodic shifts that any project goes through, we had to be committed to a set of non-negotiable principles. We developed guiding principles to anchor the project in right values and principles. The objective was to strive to make structural difference to power relationships, whether it is gender or caste, enhance participation, reduce stigma and discrimination, and mainstream the community. Now it is very essential to understand how the BAGALKOT demonstration project defined these principles and translated them to values and practice. It is essential to understand the processes that we followed, the challenges that we faced and overcame, to ensure that these principles are binding on all of us who are responsible to implement different facets of the project. To begin with, it is important to understand that these principles are universal and have been articulated in NSEP 3. Gender is very often equated with women. In many programs, development programs I've seen, when we talk about integrating gender, we actually talk about working with women. But we forget that men are equally important. So they need to also go through these processes of reflection, understanding this power dynamics and attempt to make a change. Especially it's important as HIV/AIDS program where we are talking about two people. If we're talking about, let's say, condom use, a woman alone can't use condom. She also needs a man's support to use that condom. That was the basic principle in mind when we designed this link worker program, when we talked about having a male link worker and a female link worker. When link workers started working and we used to have this reflection meeting every month, we found that the link workers were reaching married women. They were in groups like Mahila Sangha or SHGs. And they were reaching young men who were in youth groups, and there were a lot of active youth groups in these villages. They were completely missing young unmarried girls who were either sexually active or would get sexually active sometime later, and married men. It was a very important omission because in our SNA findings and our discussions with sex workers, we found that higher married men go to sex workers, or higher married men have multiple sexual partners. Missing out on the married men group was completely unacceptable in HIV/AIDS prevention program. Similarly, for young girls, we found that they were very vulnerable. They were vulnerable to abuse. They would get into marriage or a sexual relationship without much information. So they were very vulnerable. We thought it is important that we actually consciously start forming groups, consciously start working with young women and married men, while using the existing platforms that were there for married women and unmarried men or young boys.
So when we were working with the Devadasi sex workers in BAGALKOT, and when we talked with them, we realized that we couldn't only focus on their short-term risk for HIV. We had to start looking at a broader set of vulnerability issues. They had issues with their family, they had issues with their children, they had issues with their interactions with the community. We needed to address all of those issues in order for the risk reduction activities to be really effective. We also got a sense that all of this anecdotal information we were collecting had to somehow reflect itself in a design. And so we went through a process of a more formal process of discovery. And we started with a multifaceted situation assessment, where we went to villages and we looked at what were the vulnerabilities of the village. Was it, whether it be because of submergence, and relocation because of the major dam project in the area, or whether it be because they had a lot of migrating workers coming in or going out, whether they were in a drought-prone village. So we wanted to capture the diversity of vulnerability within the district. We wanted to find out what was happening within the villages in terms of risk behavior. What was the type of risk behavior? Was it mostly risk behavior within the community? Was it people going out of the community? Was within the community, were there particular groups that were at greater risk? So we went through a formal discovery process to try to understand better the dimensions of risk and vulnerability and use that to inform the specific elements of our design. It was also important to be able to feed that back to the community at all levels.
From the beginning, it was very clear to us and to them that the program of this nature has to be a complete participation of the community as well as the implementers. we systematically developed a caucus of like-minded people. We visited all the talukas, all the bigger towns, many of the villages in BAGALKOT districts. We contacted the political leaders, social leaders, well-wishers of the village, teachers, healthcare providers, religious leaders. We made sure that all the constituencies of different categories in the village are well covered. We had put together a very good caucus, and with the help of the caucus, we went to the community. We found that tremendous support, willingness and the goodwill was there in order to introduce such intervention.
ನಾಮಕರಣ ಮಾಡಿದ್ವಿ. ಜೀವನ ಜ್ಯೋತಿ ಹತ್ರಕ್ಕೆ ಎಲ್ಲನೂ ಕೂಡಿಸ್ಕೊಂಡು ಒಂದು ನಾವು ಎಲ್ಲರೂ ಈ ಜೀವನ ಜ್ಯೋತಿಗೆ ಬಂದ ನಂತರ ಎಷ್ಟು ಸುಧಾರಣೆ ಆಗಿದ್ದೆವು ಮತ್ತು ನೀವು ಹೆಸರು ಇಟ್ಕೊಂಡು ನಾವು ಈ ಜೀವನ ಜ್ಯೋತಿಗೆ ಬಂದ ಕೂಡಲೇ ಇದು ಒಂದು ನಾವೆಲ್ಲ ಕೂಡ್ಕೊಂಡು ಇಷ್ಟು ಇದು ಮಾಡಕತ್ತಾನ ಇದು ನಮಗೆ ಒಂದು ಇದನ್ನು ಕೊಟ್ಟೈತೆ, ಲೈಫ್ ಕೊಟ್ಟೈತೆ ತಿಳ್ಕೊಂಡು ಎಲ್ಲರೂ ಕೂಡ್ಕೊಂಡು ಏನು ಹೆಸರು ಇಡಬೇಕಪ್ಪ ಅಂತನ ನಮಗೆ ಪುನರ್ಜನ್ಮದ ಜೀವನ ಜ್ಯೋತಿ ಹತ್ರಕ್ಕೆ ಹೆಸರು ಇಡ್ನತ್ರಿ ಎಲ್ಲರೂ ಸ್ವಚ್ಛದಿಂದ ಇದು ಮಾಡೋಣ ಅದೊಂದು ಜೀವನ ಜ್ಯೋತಿ ಹೆಸರು ಇಟ್ಕೊಂಡು.
ನನ್ನ ಹೆಸರು ದ್ರಾಕ್ಷಿಣಿ ಬಡಿಗೇರ್ ಅಂತ. ನಾನು ಜೀವನ ಜ್ಯೋತಿಯಲ್ಲಿ ಒಂದು ಸದಸ್ಯರಾಗಿದ್ದೇನೆ. ಜೀವನ ಜ್ಯೋತಿಗೆ ಇತ್ತೀಚೆಗೆ ಒಂದು ಹೆಚ್ಚಿನ ಜವಾಬ್ದಾರಿ ಬಂದಿದೆ. ಯಾಕೆ ಅಂತಂದ್ರೆ ನಾವು ಕೊಡುವಂಥ ಸರ್ವೀಸುಗಳನ್ನು ಅಂದ್ರೆ ಕೊಡುವಂಥ ಸೌಲಭ್ಯಗಳನ್ನು ಜನರಿಗೆ ಸರಿಯಾದ ರೀತಿಯಲ್ಲಿ ತೆಗೆದುಕೊಳ್ಳುವ ಹಾಗೆ ನಾವು ಪ್ರತಿಯೊಬ್ಬರಿಗೆ ಒತ್ತಿ ಹೇಳ್ತಾ ಇದ್ದೀವಿ. ಪ್ರತಿಯೊಂದು ಸಪೋರ್ಟ್ ಗ್ರೂಪ್ ಮೀಟಿಂಗ್ನಲ್ಲಿ ಪುನಃ ನಾವು ಮಾಹಿತಿಯನ್ನು ಹೇಳ್ತಾ ಇದ್ದೀವಿ. ಹೆಂಗಪ್ಪ ಅಂತಂದ್ರೆ ಒಂದು HIV AIDS ಬಗ್ಗೆ ಆಯಿತು, ಒಂದು ನಿರೋಧ ಯಾವ ಥರ ಬಳಸ್ಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಆಯಿತು, ಮತ್ತು ಸ್ವಚ್ಛತೆ ಯಾವ ಥರ ಇರಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಆಯಿತು. ಈ ಥರ ನಾವು ಮಾಹಿತಿಯನ್ನು ಕೊಡ್ತಾ ಇದ್ವಿ. ಮತ್ತು ಪೌಷ್ಟಿಕ ಆಹಾರದ ಬಗ್ಗೆ ಈ ಥರ ಮಾಹಿತಿ ಕೊಟ್ಟಾಗ ಏನಾಕತಿಪ್ಪ ಅಂತಂದ್ರೆ ಹೊಸಬರು ಬಂದಂಥವ್ರಿಗೆ ಅದ್ರ ಬಗ್ಗೆ ಒಂದು ಮಾಹಿತಿ ಗೊತ್ತಾಕತಿ. ಹಳಬರು ಇದ್ದಂಥವ್ರಿಗೆ ಒಂದು ಮೊದಲಿಂದಲೂ ಒಂದು ನೆನಪಿಸಿ ಕೊಟ್ಟಂಗೆ ಆಕತಿ ಅಂತಂದು ಇದೊಂದು ಸಪೋರ್ಟ್ ಗ್ರೂಪ್ ಮೀಟಿಂಗ್ದಲ್ಲಿ ನಾವು ಈ ಥರ ಇದು ಮಾಡ್ತಾಯಿದ್ವಿ.
Basically, gathering evidence and planning our programs based on this evidence is one of the key features of ICHAP project. This in fact is one of the key principles and the foundations of all the pillars that we have under ICHAP. There are various activities that we did as a part of evidence-based planning in BAGALKOT demonstration project. We can think of two phases of evidence gathering. So it's basically taking a panoramic view of the community. This also gives us an opportunity to build a good rapport with the community, be with them, understand them, and they would kind of help us to design the project. Then once you have our projects on, the objective will be slightly different. Here, in the implementation phase, the objective is to collect information about, for example, in terms of program inputs, program outputs, and program outcomes.
I was convinced that the district administration should do something about this. Then there was no coordination between the district administration, agencies of the district administration and the HR work or the activists who were there. So what I did was to have an interaction with both of the agencies, to sensitize the district administration with the officials, particularly the health department officials and the women and children welfare department officials, the Anganwadi workers, the health workers. So that interaction we did in several steps. That is the district administration, the ICHAP and Mr. Swargavi and the community, we all three came together for a specific purpose and for a specific mission and with a specific action plan. It's very important that it will have an opportunity for the learners and other people to learn from this lesson, particularly regarding the rural response to a big problem, a huge problem. And then how the rural community along with the district administration, everybody got together and made a successfully working model of tackling the whole problem. Working model, that's the emphasis here.